If you're one of the millions of people dealing with knee pain, you've probably been told a very specific story about what's going on. A story about wear and tear, about getting older, and well, about an inevitable decline. But today, we're going to dig into the source material and uncover the parts of that story that almost always get left out. Does this sound familiar? I bet it does. It's the standard line, right? It frames the problem as just this simple mechanical thing. Your cartilage, that little cushion in your joint is just gone. And the solution they offer is just as mechanical. Eventually, you're going to need a new part. And man, that message can feel pretty final, can't it? But what if that simple story of wear and tear is missing the most important chapters? What if your cartilage is only one character in a much, much larger play? Okay, let's dive into this and see what the modern research is actually telling us. Alright, so the first major plot twist is knee osteoarthritis isn't just a cartilage problem, it's a whole joint problem. And let me tell you, that is a fundamental shift in understanding that changes everything. The real scope of the problem is so much bigger than we are usually led to believe. We're not just talking about one tissue here. Research shows it's this complex dance between the cartilage, the bone right underneath it, the ligaments, the nerves, and this is the big one, the muscles that are supposed to be supporting the entire system. And get this, here's a crucial piece of the puzzle. People with knee osteoarthritis often have quadriceps muscles. Those big muscles on the front of your thigh that are anywhere from 20 to 45% weaker than people without it. Now that's not a small difference. That is a huge deal. It tells us this is just as much a muscle failure as it is a cartilage problem. So it all kind of adds up to this perfect storm. You see, you've got an unstable joint because of those weak muscles, which creates all this abnormal loading. Then you sprinkle in some low-grade inflammation and maybe some metabolic stress, and what do you get? A vicious cycle that just keeps damaging the entire joint structure. So this brings us to a really critical question. If it's a whole system problem, why does the standard approach so often feel like it's just not enough? Well, it really comes down to a difference in philosophy. Are we just trying to slow down the fire, or are we actually trying to rebuild the system? This probably looks familiar. It's the conventional path often presented like this ladder. You start with some advice, then move on to painkillers, then maybe injections, some general physio, and when all of that fails, surgery. Now, each one of these steps is really designed to manage the pain and inflammation, to slow down that fire. And look, that can be super helpful, but it often doesn't address the underlying muscle and biochemical failures that started the fire in the first place. And the science is incredibly clear about this. The official guidelines say it loud and clear. There is no magic pill, no drug that can actually rebuild the joint structure once it's damaged. This tells us if we want to change the outcome, we have to look beyond just managing the symptoms. So this gives us two totally different ways of thinking about it. Conventional care, it's really good at slowing the fire. But an integrated approach asks a different question. What would it actually take to rebuild the system? To fix those weak muscles, correct the loading patterns, and quiet that inflammation from the inside out. Okay, so if we want to rebuild the system, we need to start by asking better questions. And that leads us to a completely different kind of assessment, a new way of looking at knee pain. So instead of just looking at a static X-ray, this approach digs deeper. It asks, how strong are the specific muscles that stabilize the knee? Are the nerves actually firing correctly? What's going on with your nutrition and your metabolism? And this one's huge. What does the joint space look like on an X-ray when you are actually standing on it? And the answers to those questions lead us to two core pillars of any real recovery. Rebuilding the muscles that control the joint and rebuilding the chemistry that allows for repair to even happen. First, let's talk muscle. And listen, we're not talking about just any knee exercises you'd find online. The research points to the importance of precise progressive loading of specific muscles like the VMO. That's that little teardrop-shaped muscle on the inside of your quad, as well as your glutes and your calves. These are the muscles that control the entire chain of movement and decide how force actually goes through your knee. But of course, you can do all the exercises in the world, but your tissues can't repair themselves without the right raw materials. It's like you can't rebuild a house without any bricks, and you sure can't rebuild a joint if your body's chemistry is running on empty. This means we have to look at the key players. We're talking about things like vitamin D and magnesium, which are absolutely critical for muscle function, boron and other trace minerals for bone and mineral metabolism, omega-3s to help calm that chronic low-grade inflammation. And then you've got your amino acids and collagen, the literal building blocks for repairing all that damaged tissue. So what does this all look like when you put it together? It's not just a single treatment. It's a whole integrated protocol that unfolds over time. It's a journey. So that journey often kicks off with that really detailed assessment we talked about. Then you might have a neuromuscular reset phase, using tools like dry needling to literally wake up muscles that have been asleep. That's followed by a progressive strength and alignment phase, all while the biochemical rebuilding is happening in the background, providing the fuel for all that recovery. And this process can lead to some truly remarkable results. What you're looking at here are standing weight-bearing X-rays. And in many cases, this integrated approach can lead not just to feeling better, but to visible radiographic improvement in the actual joint space. It really shows what's possible when you work on rebuilding the entire system. So what this all really means is that the old story, the one about inevitable decline, it's just not the only one out there. There's a new story, one that's focused on muscle function, on biochemistry, and on whole system health. And it offers a completely different path. So the only question left is it time to start rewriting yours? This framework is for educational purposes and is not a substitute for personal medical care. All treatment changes must be discussed with your treating physician.